It happens to doctors, so are nurses getting hit by the Jacqua syndrome. The National Association of Nigerian Nurses and Midwives have lamented that more than 75,000 nurses and midwives migrated from Nigeria in the last 5 years as a result of poor wages and lack of decent work environments. The association also raised the alarm over lack of social protection, insurance, inadequate compensation, and other incentives for nurses and midwives in the country. At the flag-off of the 2023 International Nurses Day in Abuja, the national president of the association, Michael Nnachi, said something drastic must be done to rescue the profession in the country. Let's share the story with you.
As the world gradually returns to normalcy post-COVID, frontline healthcare workers like nurses will continue to play critical roles in future health challenges that may arise. This year's theme, Our Nurses, Our Future, highlights the need for health system strengthening for the future. This gathering wants a lot more done to encourage the nursing and midwife profession through investments in nursing education and improvement in service delivery.
It is unfortunate that in Nigeria, the nurses are suffering a lot because of non-recognition of their key roles, which is indispensable.
Nurses all around the world need to address the global health challenges and improve global health for all by moving nurses from invisible to invaluable in the eyes of the policymakers.
Brain drain continues to play a key role in the shortages of these specialized frontline health workers due to several factors. The 2021 State of the World's Midwifery Report puts the shortages of midwives in Nigeria at about 30,000, which is 6 per 10,000 people. To close this gap, about 70,000 nurses and midwives will be needed by the year 2030, but with current estimates, only about 40,000 will be available.
There must be availability of right quantity of nursing personnel existing at all levels of care, with appropriate bent of experience, skills, and training to meet the client's needs. And the condition of service and environment must motivate the staff to promote excellent care.
As I speak, over 75,000 nurses have left Nigeria in the last 5 years as a result of poor conditions of service here in Nigeria, poor wages, and of course, people move about to other areas they are recognized.
Experts here believe that the lessons learned from the pandemic needs to be translated into actions for the future in order to ensure that nurses are protected and valued for the future. Kemi Balogun, TVC News, Abuja.
Julie, I'm not surprised at all because we started the story with the plight of the doctors. Yesterday, I saw a drone shot of the Alausa office of Nigerian Immigration Office, the passport office, and I was embarrassed. The number of youths, the number of Nigerians that want to get their international passports. This was something that wasn't compulsory, that was easy to access before, and because not a lot of people want to leave the country. But the crave, the drive to leave the country right now across all professions. Look at this one now. If the association is saying 75,000 nurses, I don't know the number of nurses we have altogether.
It's not just nurses that are leaving. All the health care providers.
I will put that industry in
comatose. It is skilled labor that these people are looking for. As I've said before, economic immigration is not something that anybody can stop. We can only improve the situation in our country so that can help keep some people here. Egypt made a law that you must first work in its public health institutions for 3 years before you can leave. That's their own way of finding a way to get, because doctors, for example, and health professionals generally are not easy to train. That's their own way of getting these people to at least serve their country a little bit before going abroad to make money. But in spite of that, between 2019 and 2022, more than 19,000 doctors from Egypt left the country, despite coming up with a law trying to stop them. You know, so we have to take good care of our health professionals because they lay down their lives for every one of us. Look at how many of them died during the COVID season.
This is even a big embarrassment.
So we have to do our best.
When you get the ratio of the number of nurses we have to population, you will be embarrassed. The same thing goes to doctors, as in that are on ground now, not to talk of 70,000 leaving that profession.
You know, once people find the opportunity, you see, in the UK, they are looking for dentists, they are looking for nurses, midwives, they are even looking for laboratory technologists. So the day the Pharmaceutical Society was talking about more than 5,000 people, their own members leaving in just, I think, 1 or 2 years. So the entire sector is affected because the welfare of these people has not been prioritized. Look at how long it took a strike before we increased their hazard allowance. During COVID, it took a strike. And the hazard allowance, we had been paying that same hazard allowance since the 80s. So we have to improve, give them the right working tools, increase their salary, improve their welfare generally. That will reduce, it will not put an end to it. It will only reduce the rate at which they are living. All the third world countries are literally under attack from Germany, from the UK and the rest. The Germans, Germany is the most advanced country technologically in Europe, but they are still looking for skilled laborers from Africa, from Asia, wherever they can find them, because their labor force is aging. So they need to freshen up their labor force, and this is the place they are looking at. A friend of mine said it's like they are at war with us. They are not at war with us. They know you can't pay your own people.
You can't retain them.
You can't pay them.
Do anything to
They are looking.
them.
These nurses, when they first get to UK, you know they still have to write exam there. They will do some jobs and then write the entry examination. If they succeed, and then they get to practice.
So, Ken, it's so alarming, and the new administration will charged with the responsibility of trying to address this Japa syndrome. It doesn't say so much about us.
For now, it is what it is. And it's not just about nurses. There are Nigerians that are doing very well here. Bankers, despite all they are being paid, they are leaving. I know so many bankers that have reserved their jobs in the banks, despite how much they are being paid, and they are moving. There are some Nigerians that have houses, not that they sold their houses. I know some of my friends who have sold their houses and picked their family and off. It is a big problem.
They want to start all over.
Yes, they don't care. Let me tell you the whole idea. Most of Nigerians moving at this point in time is not just because they want a good living. It is because of their children. Most of them have come to realize that, I think to them that, well, I have lost the opportunity, but I need to give my children a better life that I personally couldn't get during my time. So that is why you are seeing most of this. Then coming back to this, you're talking about 75,000 nurses in the past 5 years. That's almost an average of about 15,000 every year. How many are we producing? But you also come to realize the fact that nurses are one of the most highest paid people in the world, especially in the advanced world. In fact, to a large extent, even to some extent, and even doctors in certain countries. In fact, it has gotten to that. Once you get to Europe, especially Europe and in America, most people that travel, even those that came in from the arts and the rest of them, what they do is just care groups.
They're caregivers.
They're caregivers. That's what they're doing. You don't see them practice what they did. They are caregivers. That is what they do. This day job commercial, they just covers and the rest of them. And it has even been, they even made this much easier. I will tell you that during COVID and immediately after COVID, most of our people that went there as caregivers and the rest of them had their this thing converted to citizens of those countries. So you can be able to see that the situation is so drastic, and our government are not doing enough to be able to return this one. And what will you do? Anyway, nobody can stop you from moving for a better life, and that is a problem we are having now.